Welcome to Dallas Unplugged. I am Tosha here in Bruff, and today we're going to talk about what all of you are talking about, and that's COVID-19. This disease has claimed over 80,000 American lives to date, and those numbers continue to rise. Right here in Dallas County, we have over 6,800 confirmed positive COVID cases. But for this conversation, we want to talk about the disparities between our communities of color. Why are those communities more heavily impacted? We're going to talk with three guests today that are going to talk to us about the why and hopefully bring us some solutions. Let's just think about this. Many of our communities of color are filled with essential workers, workers that we depend on every day. They come face to face with this deadly virus, but we need to know, how do we protect them? Think about our home health aides. Right now, the data shows that home health aides, only 47% of home health workers have PTO. Right now, 3.4 million Americans have asked for mortgage forbearance. And we know as this virus continues to grow, so will the need. How do we protect those communities that are most vulnerable? Well, today we're going to have that conversation, and we hope that you stay tuned. Thank you both for joining me for this segment of Dallas Unplugged. Today we are talking about the impact of COVID-19 on many of our communities of color. And I thought that it was important to have you all on. We have two doctors here, Dr. Lejon Poole, who is the Director of Healthcare Management Program at Campbell University and also Associate Professor of Management. And I wanted to have you on to talk about healthcare more on a national perspective as you work for Trinity Health, that you are a chairman of Trinity Health that governs about 94 hospitals across the country, I think you said. And Dr. Edwards, who is an emergency room medical doctor right here in Dallas. He has been serving our community for decades, but he is also a historian in disadvantaged and minority health issues. So I thought it was important to have both of you all talk about from a social impact and also from a medical impact. So let's just get right into what's happening right now. The CDC just released new numbers, well, not new numbers, but just this week, that said that 18% of the general population is African American. However, they make up 33% of coronavirus cases. So I want to talk about why this is happening. And my first question goes to you, Dr. Poole. You have seen healthcare from a lot of different vantage points and performances across the country. What makes the COVID crisis more impactful on communities of color? Why is it?
Thanks, Tosha. There are a couple of reasons, well, a lot of reasons, right? But the first reason I would give is that communities of color are coming in contact with the virus at much higher rates than other communities. What I mean by that is, when you think about people who are going to be around large groups of people most often because of their job, who can't work from home like I can, it's going to be disproportionately African American, Latino, and because they can't avoid the contact. And some of the reality is that when people have to work as cashiers or as bus drivers or as clerks, our clinicians, when you talk about nursing homes, you talk about CNAs, you talk about these other frontline professionals, nurses, LPNs, they have to come in contact with the virus. So when you talk about why it's affecting communities of color more, those are some of the reasons they come in contact with it. Having access to general health care to help, diseases that can be managed from spiraling. If you don't get access to health care, preventative health care, then those diseases become much more sinister.
So as a medical doctor, I would think that our hospitals are, you would think, inundated with those essential workers, but that's not necessarily true because most of them are continuing to work. Talk about that, Dr. Edwards.
Well, and let's back up. I think that the Dr. Poole was correct. There are some attenuating circumstances, I should say accentuating circumstances that affect our community that doesn't affect other communities. That's not genetic, okay? If you don't have a doctor in your community, that's nothing genetic about that. If you take Dallas, Texas, for instance, in Dallas County, there are 2.4 million people. There are 51 hospitals. And if you take and divide it by the Trinity, you have 2 on the south side with 1,000,003 residents. You have 49 on the north side with 1,000,001. So it's more. It's not just a individual thing. But if you only give me one option, if I only have one option, you can't ask me to operate when there's out of 3 options when I only have one.
So what is the responsibility and obligation of the healthcare system? What are the things that they need to be doing better and the things that need to be put in place so we can see real change in our neighborhoods?
We have really started to focus on the social determinants of health because those oftentimes are more important or as important than the interventions that we make medically, right? So if somebody's homeless, right? So how can you keep them healthy, right? Yeah. If someone is food insecure, how can you keep them healthy? We know right now COVID actually is going to have some, at least in the short term, some negative effects on some of the investments that we were making to try to invest in communities, overall wellness, and not just because we realize that if we can't keep people well, right, at a macro level, we're not going to be doing a good job. We're just putting out fires, right? And that's not what you want to do.
So I love the fact that you're saying that hospitals have to get invested in making a difference in that piece of healthcare, not just, the medical piece of it, but also getting involved in the community. And Dr. Edwards, you yourself have, really dedicated to putting your business back into neighborhoods of color. You recently purchased a building in which you have plans on bringing a clinic to one of these communities. Can you talk a little bit about, why you're doing that? What is the purpose? What is your intent on moving there? Because you could go anywhere.
Let me just add. Let me add one other caveat to this. Let's make sure we understand the type of health system we have, where healthcare is a privilege and it's not a right. That means that you get the healthcare you can pay for. We spend $3.5 trillion a year on healthcare. That's about, if you took everybody, it would be about $10,000 per person per year. Okay, but we rank last behind comparable other countries who spend far less. But where you have something that's a privilege, if you don't have what it takes to make that privilege happen, you're not going to get that privilege, or you're going to get just a small version of it.
You know, how do we advocate for our own communities? One of the things about how this whole podcast was birthed was to talk about issues that impact our communities and educating people on how they advocate for themselves and use their voice to bring change to their communities. What do you say? What do we need to be doing?
What we're organization, right? And you have to have, groups of people that are like-minded. There's something in Raleigh called Southeast Raleigh Promise. What we did was a person who was from that area, Southeast Raleigh, which currently is a fairly impoverished area. She said, what can we do? How can we improve this community, right? So talking with other leaders, some politicians, some entrepreneurs, they started a fund and they partnered with the YMCA. The idea is that in 10, 15 years, you're going to start seeing the fruits of that labor. And part of the conversation has been, I don't know if this happened yet, but I know it's happened. This is part of the advocacy portion, which, by the way, healthcare systems have to be a part of the advocacy, right? And you've got to have people that are like-minded and that want to affect change.
I agree with you, both of you, wholeheartedly about collaboration. I think it takes a collaborative effort with groups that care and want to make an investment in the community. Matter of fact, Dallas Habitat just donated some land in one of our communities, our Bonton community, for an agape medical clinic. And we know that health is vital and it's important to, our communities and helping the children and the families in that community grow and thrive. So that is something that we're working on in that effort. Although our business has, people think of it as building houses, but it's about building community. But I thank you all for being on. You all have been a wealth of information and knowledge. And, I feel as though we're all going to come through this. But thank you so much for all that you do for the communities that you serve. Thank you very much.
Dr. Edwards, it was a pleasure meeting you.
Yes, sir. Thank you. And let's stay in touch.
Absolutely. Tosha, good seeing you.
Thank you.
Too.
Good seeing you.
Thank
you. All right.
Thank you.
All right.
Dr. Haynes, welcome to Dallas Unplugged. It is a pleasure to have you here with us. I'm a huge fan, and I've known you for a long time and all of the great work that you're doing. But Dr. Haynes, for 37 years, has been the visionary leader and senior pastor of Dallas's own Friendship West Baptist Church. It's one of the largest leading churches in our city. Under his leadership, he has about 12,000 members. So his daily work, he's bringing and saving souls and bringing people to Christ, which is a wonderful thing. But here's what's interesting to me is that a big part of his ministry is around social justice. And for a very long time, Dr. Haynes has been a committed community activist, working with local community leaders and Dallas officials and how to fight social justice, whether it's domestic violence or poverty or in economics. So I wanted you here today because most recently you were quoted on CNN about the work that you're doing locally in regards to this national pandemic. You called for a moral appeal to the current administration. You said that, there's something we need to do morally about what's happening. Why did you ask for that, and what does that call for?
Well, and again, I want to thank you so much, Tosha, for all that you are doing. You are a gift, and it's just exciting to see how you are being used in a very powerful way to make a difference in our community, especially on behalf of those who are struggling and often have no voice and are left behind. So I'm deeply honored that you are allowing me to be a part of this conversation. Infections anywhere are a threat to good health everywhere. So if I'm unhealthy, because I got Rona, because of my underlying conditions that are
Yeah.
really the result of social pre-existing conditions, and I come in contact with someone who is healthy and they don't look like me, guess what? You can be exposed to this very contagious, very unpredictable, and sometimes fatal virus. And so morally, we have got to recognize we are in this thing together.
And what you're saying is so profound, Dr. Haynes, because, I've been saying this, or we've been talking about going from, from habitat to humanity. And what's important is here is that, beyond building a structure, which we're known for doing, part of our responsibility is obligation is communities and neighborhoods. You can build a house and put somebody in a neighborhood, but if that community is not healthy or thriving or progressing, we're contributing to an issue that is not being rectified, and we can't just glaze over it. And I love the fact that you say it's all of our issue. It's not Southern Dallas issue, it's an issue for all of us. And when you look at the landscape that we're in right now, how should we be advocating to our policymakers and the people who are in positions of power? I read something the other day that says we can't wait on them. We need to think about how do we advance this ourselves. But at the same time, we understand that policy plays a big role in how our communities are taken care of. So what should we be saying to these people?
Thank you very much for that question. That's profound. And for me, it begins with our community designing what I call a vision for wellness and wholeness. So what does it mean to have a healthy community? What does a healthy community look like? Because everything has to start with our reimagining what we want our communities to look like. And a healthy community has got to have certain components, such as, again, access to affordable health care and whatever else this pandemic is teaching us, and that is everybody should have the right to affordable health care. They should have health care that is not just affordable, but health care that is accessible. Move into our current crisis. One of the things, I'm a part of a wonderful coalition of faith leaders led by Bishop William Barber, and we have sent a moral appeal to the president, to the House Speaker, as well as to the Senate Majority Leader. And we are saying to them that we need a stimulus package that focuses on those who are impoverished, that focuses not on the top down, but on the bottom up. If you don't start at the bottom, again, this virus is you're not going to flatten any curve because you're not dealing with the real curve in an emergency fashion. Address what's going on from the bottom up, and at the same time, look at beyond this crisis. And this, for me, is so important. No crisis should leave you the same way it found you. So we ought to come out of this crisis better than when we went into the crisis. But we come out better based on the decisions and choices we make while the crisis is going on.
And that's why, and I appreciate that, because that's why this conversation is so important, because it's about community. And I knew that your work would touch on all of those points. The government, as they're deciding on to reopen and have businesses back up and running, and I get the economy needs to continue to move on, but one of the things I think our communities are fearful of, and is opening too soon. And what does this do to the communities that are already suffering? What do you see as some of the impact of that, and are you concerned?
I'm greatly concerned. For our community's sake, I say, look at the disproportionate numbers when it comes to our dying our being diagnosed with this. America is acting like we're in the ninth inning of a baseball game, when in reality, we're in the second inning. This game is just getting started. This virus is so unpredictable that we can literally create another curve, which is really interesting. Like they've been talking about flattening the curve. And if we do this too quick, the sad reality is another curve will pop up.
I am just, proud of the work that you're doing in our communities. And, how do you encourage, you have a big job to get up on Sundays and virtually, which, your ministry has gone virtual, just like most of the nation. How do you encourage our communities, and not just our communities, and the people who want to work with us, people who say, we need to do something, and we need to be able to stabilize our communities and create thriving and growing neighborhoods? What do you say to families that are living in those communities that are impacted? And then what do you say to everyone else who needs to be a part of the work that you're doing?
So my first appeal, Tosha, is that we take care of ourselves internally, that we take care of ourselves personally, because if I don't take care of me, there's nothing I'm good for the community in terms of fighting to make sure that things improve beyond this crisis.
Absolutely. And I thank you for that, Pastor Haynes. I keep saying Pastor, Doctor, I know they call you up. You have all of those titles. And I just appreciate you taking the time to be with here and talking to our listeners. I think one of the responsibilities that we have, and reason why we started Dallas Unplugged, that's sponsored by the Habitat, is that we needed to figure out a way to connect to our community and educate people on what's happening and why it matters. And this is why it matters. And so again, thank you so much for being here, because it's about all people, not some people, it's about all people and taking care of all people. As a country, we have that obligation, and it is back to humanity. Again, thank you. God bless, and stay safe, Pastor Haynes.
You too. Thank you so much. God bless you. Keep up the great work.
Thank you. Stay tuned, because we have some amazing guests that will be joining us on this journey. You don't want to miss it.